Okay. Good morning, everyone. Good morning, Raghu Garu and Subbarao Garu. Thank you for giving us this opportunity to present our small effort to bring awareness in mental health awareness to all the students of Aditya Engineering College. We are an organized voluntary organization called HAFA, which stands for Health Awareness
Go ahead.
Health Awareness for All, which is an organization started during COVID to educate rural people about COVID and how to deal with COVID. And we eventually transitioned into supporting young students about mental health and then mental health issues that they need to be aware of and to deal with these so that they know what to expect and then how they can educate themselves and help each other in this mental health journey. Now we have some doctors that could not join today, but we have Dr. Ambati here. She's a cardiologist in Apex, North Carolina, within in USA. She will start over, and then Dr. Bindu and Dr. Mahiza will join, and then we'll all answer any questions the students might have once the presentation is over. If the students have any questions in between, you can park them or you can ask them in between also. Now I hand over to Dr. Ambati. Go ahead,
Thank
Dr.
you,
Ambati.
Mr. Sandeep. Hello, Amma. Good morning. And it's so nice to see all of you. My name is Dr. Srivani, and it's such a pleasure to see young faces. And, I completely understand, when you were in college about this time. Can you hear me? Can you all?
Uh, just would you prefer in Telugu or in English, sir? If you prefer in Telugu, so, Satish garu, we can change to Telugu and we both speak Telugu.
Okay, let's do this. But నేను వినిపిస్తుందండి. Can everyone hear me? Okay, wonderful. Again, thank you so much for giving this opportunity. And as Mr. Venkat has told, ours is a very small organization. We are very passionate about mental health of the young students like you all, because we have so much, you have so much potential and so much wonderful life ahead of you. And we hate to have small issues like mental health issues to affect the life. So we have about 4 psychologists and psychiatrists collaborate this, and one college at a time, we thought we will make you all aware of the common conditions. This is not a treatment, this is not a diagnosis. We are just here to talk about it. And the reason I wanted to see you all is so that we can communicate with each other. This is not a lecture, so feel free to ask, get up and go if you don't like, doesn't matter. Whatever you feel like, this is just a informal exchange of information. Okay? So before we do, I will go ahead and start my presentation, and let me know if you all can see the slides. All right. How do I share my screen? Oh, there we go. All right. So is my slides visible to every one of you? Okay, all right. So as I said before, this is mental wellness. Let's not talk this as a disease. It's not a disease. We're going to talk about what is mental wellness. So most of the time, it is the most often overlooked side of the health, I feel. Okay. So this is me. I don't need to, an extended introduction is not needed. And Dr. Bindu has just joined. Thank you, Bindu. And that is her. and she is a consulting psychiatrist for Border Security Forces India. And she has variety of interests, and her most passionate thing is counseling the troops and their families, especially with separation and anxiety. And she's very passionate about psychological health of the young students like you all. And thank you, Bindu, for joining. And Dr. Ashrita could not be here. Dr. Mahija will join later. And okay, let's start talking about what is actually mental health. Good morning, Bindu. And what is actually mental health is very simple. How we think, feel, behave, and interact with each other. How we talk to each other, how we talk to a friend, how we talk to our teachers, how comfortable we feel in it. This is all part of mental health. Pretty much, mental health is our life. What we do on a daily basis is consist of mental health. Okay, especially in terms of how we maintain our mental clarity in the faces of stress. That's we will talk about it. Okay, so now we all know, we all talk about mind, we have to keep our mind clear and this and that, but healthy mind is very, very important for personal, social, and academic success. You know, you could be doing great in marks, 100% scoring, but if you're not healthy mentally, eventually it does not lead to success. So, for an ultimate happy life, a very healthy mind is very, very important. So, I always say our mind is constantly thinking about it, constantly. And I think it's time we start thinking about it, okay? So, let's think a little bit today and let's talk about the mental health. So many mental health issues are there. In fact, Dr. Bindu is an expert in that. And but we don't have time to touch on all of them. Let's talk about the most common things like depression, anxiety, and suicide thoughts and suicidality. And of course, the other things also we'll see if we can touch if we have time. Okay. So these are very, very common. Everyone thinks the mental health is for someone else. నాకు కాదు ఎవరికో వస్తుంది నేను ఐఎమ్ బియాండ్ దట్ అదొక రకమైన సెల్ఫ్ బిహేవియర్తో వీల్ వాంట్ టు మూవ్ ఫార్వర్డ్ బట్ ఇట్స్ వెరీ కామన్ if five of you are sitting in the first row, one of the five is suffering from anxiety. And it's okay. It is not a big deal. But it's very important to identify a lot of people are suffering from anxiety. And similar situation is depression. You know, 1 in 20 Indians suffer from depression. And depression is not like depression word is very vaguely used. If you're, oh, I'm depressed. Not really. Actual depression is a bit more concerning, but we will talk about it. And in 2012, and unfortunately, these are old stats we have. India, there were about 258,000 suicides in 2012. So you can imagine it is a real problem. And just because we are trying to ignore it, it doesn't go away. And even alarming and very difficult thing to know is from this is not common in like ever some old people have it, I don't have it, and that's not the case. Most common group that is affected is 15 years to 50 years. So you can tell how young the individuals are suffering from mental health. So what do we do? Most important thing is not to ignore, identify. And very, very easy for all of us to say, I'm too busy. I'll think about it later. Let me finish my intermediate. Let me finish my engineering. I'll think about it. I'm too busy. But that's not the right thing to do. Early diagnosis of mental health issues is very important for better outcomes. The earlier they're diagnosed, the better they will be. And not only that, like I'll be using some Telugu words in between too, if that's okay. Mental health issues can cause irreversible damage. ఒకసారి డ్యామేజ్ జరిగిన తర్వాత it's kind of difficult to come back. So that's why it's much easier to identify early, try to treat it early if it is a problem. ఎందుకంటే irreversible damage to interpersonal relations. ఎందుకంటే once mental health is affected, everything in life is affected. చదువు ఎఫెక్ట్ అవుతుంది, లైక్ రిలేషన్స్ విత్ పేరెంట్స్ ఎఫెక్ట్ అవుతాయి, ఫ్రెండ్స్ ఎఫెక్ట్ అవుతుంది, తర్వాత ఫ్యూచర్లో హస్బెండ్స్, వైఫ్స్, ఆల్ దీస్ థింగ్స్ విల్ బి ఎఫెక్టెడ్. సో ఫస్ట్ బిగినింగ్ ఫేజెస్లో ఉన్నప్పుడే ఐడెంటిఫై చేసి కరెక్ట్ చేసుకోవడం ఇంపార్టెంట్. ఓకే, so especially in these young years, you're so young and this is the time to think about it. And again, if identified early, this can change the course of life in a very positive way, very quickly, very easily managed, and it will lead to a really good success in life. And so we talked about all these early diagnoses, same cheyali, idi adi ani, but what do I do? And if you ask a question, em cheyamantaru ante, first thing is, do not ignore these symptoms. And we always used to say ignorance is bliss, but ignorance is not bliss in case of mental health. So knowledge is power. Know about what these conditions are, know how we can diagnose them, and let's take the first correct step towards taking care of the mental health. Okay? So what is the problem right now? Why is the mental health has become such a big issue is there's so many difficulties that we face. Chala hurdles vastunnai. Number one, it's very difficult to diagnose. ఇప్పుడు ఎవరికైనా డయాబెటీస్ ఉందనుకోండి, హై బ్లడ్ ప్రెషర్ ఉందనుకోండి, oh, it's very easy. Do a test. Oh, you have it. But mental health is not that easy to diagnose. Mental health issues are pretty much, they're mixed with the day-to-day lives. So its first problem is very difficult to diagnose. Second problem is patients themselves deny the fact. They don't come forward. If they don't come forward, what can anything be done? So denial of the problem is number two, sorry. And the third is societal stigma. Still all over the world, people consider mental health is like a bad thing. If someone has a mental health issue, oh my God, this is the end of the... And హేళన చేస్తారు, ఎగతాళి చేస్తున్నారు. దానివల్ల ఏం చేస్తారు పేషెంట్, పిల్లలు కానీ పెద్దవాళ్ళు కానీ ఎవరైనా, they don't want to come forward. So that societal stigma is playing a major role. And the fourth thing is lack of professional resources. So for some reason, we all identify, okay, I need some help, but not enough doctors out there, not enough therapists out there. So lack of professional resources is the fourth important reason. And finally, financial strain. All these appointments, visits, and all these things are going to take a lot of financial strain on the family and the person. Okay. So let's just jump into the common mental health issues. As I said before, anxiety, depression, and suicide are the most common. And I just thought, like, just a simple picture will kind of help identify. You can see that poor child is suffering from so many things. So many things are dragging him from every direction. And so let's start with anxiety and stress. What is normal and what is not, right? Every one of us have anxiety. We are doing so many things. So it's quite common to be anxious. It's quite common to be stressful. But when do we differentiate what is normal stress? What is abnormal stress? And everyone asks me, isn't stress a routine part of life? Yeah, of course. But there is a demarcation. What is it? Where do we draw the line? Again, it's not very easy to do. Though, just one thing to remember though, when stress begins to overwhelm you and then cause difficulties to focus, and if it's interfering with your relations, it's interfering with your performance in school, and ultimately, if it's making you sad, then that is not a normal stress. So that need to be dealt with professionally. So that's a simple way of recognizing what is. So if someone has a final exam Feeling stressed out a little bit is okay, but enough to the point that you cannot come out of the room and your hands shake when you put the pen on and you start like running away from the problem, then that is about time to seek help. That is not normal. Okay. So how to identify anxiety? It's very simple, and I thought you can, relate to these pictures. So frequent worry about small little things and and interfering with your daily life. For example, I don't want to go in a bus. What might happen to the bus? I don't know if I may fall. I may get an accident. Little bit of fear is okay, but unusual fear stopping you from living your life is a concern. And second is withdrawal from social life. So mostly if you're not worried about anything, you'll have like a nice day and talk to friends. But once you stop interacting with outside life, withdrawal from social life, that's another sign. And fixation on fear of next panic attack. That means always worried, oh my God, when will I will be anxious. I know I'm going to be anxious. I know I can't deal with it. So always worried about the next step is another one. And again, irrational fears, like when a phone rings, when something is going to fall, all these are irrational fears. Okay. And recurring nightmares, flashbacks, and all these things are signs and symptoms of anxiety, like severe anxiety. We'll deal with we'll go back how we can deal with the anxiety, but let's a few more lines about depression. So a lot of you have heard about it. We all have ups and downs in life, and all of us went through, phases that we feel down, feel up. But depression is beyond that small little not feeling good, feeling sad and emptiness all the time. Worthlessness. నేను ఎందుకు పనికిరాను నేనేమి చేయలేను hopelessness. Like ఒక టార్గెట్ పెట్టుకోవడానికి కూడా before you put a target, you think that you're going to fail. That is initial sign of depression. That means hopelessness. There is no hope. If I don't want to go to college or I don't want to go to school because there's no hope for me, I'm not going to pass, I'm not going to graduate. This is all the signs of depression. And most of the time, these are on very simple causes. And many times, people who are depressed also go into angry outbursts, irritability. So suppose one of your friend, any of those, very happy normally, but then all of a sudden you start noticing them very angry, irritated, and frustrated, then something is going on. It is not something that he or she is like a bad person or anything. But mentally, maybe she's going through a lot of things. Maybe this is the time to talk to them. Okay. So angry outbursts, irritability, and frustration over very small matters and simple, like, having a little bit low marks on a test. And that is the reason. Okay. And loss of interest or pleasures in normal activities. As we said before, normally if you enjoy watching movies, listening to songs, but then all of a sudden they don't feel any important. That is another very strong sign of depression onset. And again, withdrawal from family and friends. No connection. Friends నందరినీ దూరం చేసేసుకుని ఫ్యామిలీ మెంబర్స్తో దూరం అయ్యి పెళ్ళిళ్ళకి వెళ్ళకుండా ఫంక్షన్స్కి వెళ్ళకుండా no interest in dressing up, no interest in singing, no interest in watching movies. These are all lack of interest in normal activities that they normally use to please you. Another physical symptoms ఏంటంటే severe tiredness, విపరీతమైన tiredness, sleepiness, weight gain or even weight loss, lack of appetite or too much appetite. These are all very important signs of depression. And again, another very important symptom of depression is fixating on failures and self-blame. If something didn't go right, నేనే కారణం దానికి, నేనే నా వల్లే ఇలాగైంది. So they're not able to see any positive things, but only seeing negative things is another telltale sign of the depression. And next phase would be trouble thinking, because mind is overwhelmed with these thoughts like, I am a failure, I can't do this, I'm going to do bad on the test, everybody will be angry, my friends don't like me, I don't look good. All these negative things are overwhelming. Then they cannot focus, they cannot think. So trouble thinking and concentrating is another very, very important sign. And finally, and sadly, frequent thoughts of death and self harm are very common in depression. Okay. So, how to identify? Pretty much what all I said in a picture. So if you thought, like, if you look at it, sometimes it might be easier to remember. Okay. Again, isolation, feeling of guilt, not able to concentrate, sadness on trivial issues, helplessness, sleeping problems, food problems, and unusual anger bouts also, it's very common. Thoughts of death. And the worst thing about depression and anxiety is alcohol and drug use. When people go through these phases of anxiety and depression, especially when they don't know what to do, they're confused. They themselves don't understand why they're feeling like that. They don't like it. They want to correct it. So what is the best way of correction is seek professional help. But unfortunately, that's not happening as we wanted to. First thing, especially young students do is alcohol and drug use is the first thing. That is one of the worst thing that can be done for mental health, because that is the first step of things going in a completely wrong direction, and unfortunately very, very wrong outcomes. So we will talk a little bit about, so many times, especially we see in young children, okay, Nick Bagledra, you don't feel good. Okay,
I think he's saying
have
something. I think he's saying something. He may want to say something.
I'm sorry. Okay. Is there any questions for me?
Excuse me. We have a small issue with the projector. Can you give me 2 minutes?
Sure, sure, of course.
Sure,
No
sure,
problem.
sure.
We'll be back in a couple of minutes.
Sure.